Hi, welcome back, everyone. We're excited to have Dr. Leanne Woods-Burnham and Dr. Brian McNeil rejoining us for this Q&A panel discussion following their panel discussion. Unfortunately, Dr. Kelvin Moses wasn't able to join us. The question I want to present to you first to get us started, Dr. Woods-Burnham, is on shared decision making, and that term kind of came up in the panel. It's a familiar term to a lot of people, but it also is one maybe that is more of an insider term that we talk about in the advocacy space that the average patient might not know about, certainly if they're haven't even been diagnosed with prostate cancer. So can you, Dr. Woods-Burnham, define what shared decision making is?
Sure. So what it's supposed to look like is a patient walking into their doctor's office, and for that physician to be able to describe the pros and cons of prostate cancer screening. So they should be able to talk to their patient about their personal risk factors, their family history, and given the pros and cons, then it's called shared decision because the physician is not the only person that is making that decision. So the patient very much so should have a voice and an opinion about what they would like to do. And that's not just for prostate cancer. That's, for a lot of different disorders and just taking charge of our health in general. But that's what we mean by that, is that a discussion occurs regarding the pros and cons of screening for you as an individual.
Thank you for defining that for us. That's helpful. We just want to make sure everyone knows what we're talking about when we say that. So I appreciate that. And Dr. McNeil, we had one of the comments that came up in the comment section for today was somebody was just mentioning as they go to the VA for their care, they're a veteran, and how many young men they have encountered at their time there, actually under the age of 40, who have been diagnosed with prostate cancer. And so I just thought that that was an important point to highlight that veterans are at a higher risk for prostate cancer. And so, Dr. McNeil, what advice do you have for veterans who are wondering about their risk and screening, and what the right cadence of screening is, or when they should first get screened?
Thank you for the question, Jeremy. I actually think that Dr. Woods-Burnham has given us the ultimate segue. And we'll take this back to shared decision making.
Yeah.
There have been some studies which have shown that veterans are at higher risk of prostate cancer. And the thing that we'd like to encourage is for those who are concerned to have a conversation wherever they seek healthcare about prostate cancer screening and whether or not they should get screened.
No, I appreciate that and agree. Like you said, we kind of she teed that up for us perfectly with the shared decision making. And I think it's an important tool to remember too, not just for, of course, today we're talking about early detection and screening, but shared decision making should continue throughout, no matter what health condition. But certainly as we're talking about prostate cancer, if someone's diagnosed and considering their treatment and management of their side effects and all that conversation, we want that shared decision making to continue. So,
Jeremy, if I could elaborate on that a little bit too.
Please.
So, there are some diseases where you get a diagnosis and it's just a very clear-cut pathway to this is what the standard of care treatment would be. Prostate cancer, and Dr. McNeil can definitely piggyback on this, is so individualized and treatment options are so varied, and what one man is comfortable with is different than what another man is comfortable with. And so shared decision-making is, I feel, extra important for prostate cancer patients to tease out the nuances and what stage that person's prostate cancer may be at. And even before you get to a diagnosis of prostate cancer, just the screening tools beyond the PSA test. What are we going to do next? What type of biopsy is this going to be? What sort of imaging are we going to do? There's a lot of different factors that go into play. And so shared decision-making is extra important in this context.
Agreed, Dr. Woods-Burnham. Actually, there's a funny statement that I'll share when I interact with patients oftentimes. Often tell patients that they are the boss of them, meaning you are the boss of you. You know, we're here to give you good information and we're here to help you make the best decision for you. But we can't necessarily tell you what's right for you all the time. There are so many different treatment options for prostate cancer, from, minimally invasive to really invasive and aggressive. And we're just here to help you make the best decision for you. You're the boss of you, and shared decision making is a part of that.
I agree. Yes, thank you for that extra emphasis on the importance of this in prostate cancer. And Dr. McNeil, your comment makes me think I have a friend in the patient advocacy space in breast cancer who advises, she works particularly with Black women, advises them that they are the CEO of their own health and they're the CEO of their doctor even. So that it reminds me of what you're saying. Be your own boss and take charge of your health and those conversations. So thank you for that. One of the things we talked about in the panel, and Dr. Woods-Burnham, you brought this up in particular, was a pushback that your husband had received. And so I think that these conversations about shared decision making are helpful, about the term of, you're the boss of your own health. All of this comes to remind me that just how important it is to have these conversations, that we're meeting here today and talking about this in the prostate cancer space, and bringing light to this issue, because we want people to hear this and share it in the community widely, right? That the Black men are at higher risk, that there are now guidelines imploring them to have these conversations with their doctor and consider screening at the age of 40, that there are PSA testing available for them. And Dr. Woods-Burnham, I want to come to you because I know you do this out in the community all the time. It's one of your main roles is kind of coordinating for Morehouse School of Medicine, PSA testing, education in the community. What are you seeing out in the community in terms of both? We talked about myths already during the panel, but in terms of just awareness of prostate cancer in the community, is it where it needs to be? And then also kind of the follow-up question is, what is the response that you're seeing in the community once people kind of learn of the risks and understand that there's free PSA testing for them? So can you talk more about your work in the community that's so important?
Yeah, so at Morehouse School of Medicine, we provide prostate cancer testing, free PSA testing. We have a program called Prostate Cancer Precision Prevention Program. So in short, we call it PCP3. And what we see when we go out and we provide this free testing and education is there are, some men that are not aware that they are at a higher risk. I've seen some regional differences, because I was out in LA before this, I was in Ohio before then, and now I'm in Georgia. And, certain regions I've heard more often than not that they are unaware of their risk, or there's a lot of times a feeling of, as long as I am exercising well and I'm eating the right diet, that I'm going to be okay. I'm not going to be the one to get prostate cancer. And so a lot of times it's eye-opening to sort of point out biological and inherited risk for prostate cancer that some populations have more than others. And we can't we can't change our DNA yet. You know, there's these sci-fi movies out maybe in the future, but as of now, we can't change our DNA. And so what is passed on to us there are certain genes, unfortunately, that make certain individuals more likely to be diagnosed with certain diseases more than others. And so for prostate cancer, we know that to be the case in Black men or men of West African ancestry specifically. So that extends to Latino populations as well that have a high West African ancestry. So the first piece is understanding the risk for prostate cancer that go beyond just diet and lifestyle. And then once men find out that they don't have to necessarily do the digital rectal exam, that it's just a blood test and it's the PSA test, then they typically jump on board, no problem. They're like, oh yeah, let me just get this over with. One thing that we find is a lot of men feel that because they go to the doctor annually, which is great, but they feel that since they've gone, that the PSA test has already been provided. And some are shocked. They'll actually, pull their phone up and go on their medical app and they'll say, look, I went to the doctor, he ran these tests. And some are shocked to see, oh, wow, PSA was not included. And so that is eye-opening to some to realize they now want to go back and circle back to their physician and sort of have a conversation as to, why wasn't this included? Can this be included in the future? And then the final point I would add is then once men receive their results, because we return their results back to them within a week or two, a lot of men are surprised that they have elevated PSA levels, especially because prostate cancer is a disease where there really aren't a whole lot of symptoms until it's more advanced. And so, men I know even when I think about my dad, he was eating well, exercising at the gym, full of energy. He never gets the cold, never gets the flu. And he was like, what do you mean aggressive prostate cancer? He didn't even have symptoms where he was urinating frequently or any sort of sexual dysfunction or anything like that at the time. So that was surprising to him. And it's surprising to a lot of men when they do come back having elevated PSA. And we have even seen here in Atlanta, I can think of a few situations where we've had brothers coming to events together and multiple people of the same family finding out that they have elevated PSA. And so that is what makes what we do feel meaningful to me. It's one thing to change a person's life. That's great enough, right? If they can detect it early, we know that there's a very high cure rate. But when you know that you're affecting that person and then their family and then their siblings and then their families, and that word of mouth is going to trickle throughout the community, it's very encouraging and motivates us to do what we do.
Thank you for that and for all your work in the community, because it's so important. So Dr. McNeil, you're in New York, correct?
Yes, correct.
Okay. New York City, I believe. So tell us what, Dr. Woods-Burnham talked about some of the regional differences, but just what in your work in the clinic when you're meeting with patients, tell us what you're hearing from when you, as a urologist, are seeing men. Are you seeing them generally because if they're concerned about prostate cancer, are they being referred from their primary care physician to you? Have they already had a elevated PSA, and is that why they're coming to you? What's your first touch point with these patients generally?
Thanks for the question, Jeremy. My first touch point with patients usually has nothing to do with prostate cancer at all. There are some patients who get referred over because of an elevated PSA level or because their siblings or father may have had prostate cancer. But usually I'm referred men who just want an overall general checkup because they're urinating more frequently at night or more frequently during the day, or perhaps their erections aren't as hard as they used to be and they're sort of interested in seeking help to satisfy their partner. Those are the things that bring folks into the office more. And I oftentimes introduce the conversation about prostate cancer and prostate cancer screening. So that's typically where it starts. And lately, I think that pop culture has something to do with prostate cancer as well. If there's someone notable who, has recently been diagnosed or shared their prostate cancer journey, that will lead to an increase in referrals with regards to prostate cancer screening. One thing that happened recently, I'm not sure if you all are basketball fans, but college and NBA great Alonzo Mourning recently shared news about his battle with prostate cancer and the fact that he was recently treated. And just in the last 24 hours, I've heard from folks who are interested in getting screened for prostate cancer because they heard about Alonzo Mourning's story. So I think that the more vulnerable and open folks are, just overall, I think that it will raise sort of awareness of men's health issues, and in particular, prostate cancer.
No, I'm glad you brought that up, and I agree. I think that's why we're having this discussion. And it is the more people tell their stories, and the more like Alonzo Mourning, I think it helps to drive these conversations.